If your legs feel heavy, achy, or swollen by the end of the day, and you are over 70, most people assume there is nothing simple they can do about it. They have been told to walk more, to elevate their legs, to drink more water. And while all of that has value, something much more specific is often missing. Here is what many older patients do not hear until they are sitting in a surgeon's office after a procedure. Before patients are allowed to leave recovery, before they take a single step, there is one exercise they are asked to perform right there in the bed. Not because it is easy, because it works faster than almost anything else at restarting venous blood flow in the lower legs. That same exercise is almost never talked about outside of a clinical setting. Most people go their entire lives without knowing it exists. And yet it takes less than 5 minutes, requires no equipment, and can be done sitting in any chair. In this video, I will walk you through that exact exercise, the one many vascular surgeons quietly consider the most efficient circulation reset available to older adults, and I will show you precisely how to perform it safely and correctly. Before we begin, leave a comment with your age and where you are watching from. And if someone you know struggles with leg discomfort, please share this with them. Here is something that is taught early in vascular surgery training but rarely makes it into everyday health conversations. Your heart pumps blood down to your legs without much difficulty. Gravity helps. The real challenge is getting that blood back up. Your veins must push blood upward against gravity, through a system of one-way valves, with no direct pump of their own. What they rely on instead is muscle contraction. Every time a muscle in your lower leg squeezes, it compresses the veins nearby and pushes blood upward toward the heart. When those muscles stop contracting, during long periods of sitting, or as they weaken with age, blood tends to slow and pool in the lower legs. This pooling is the direct cause of swelling, heaviness, aching, and that tired sensation that builds throughout the day. It is not simply aging. It is a mechanical problem with a mechanical solution. After 70, two things often happen simultaneously. The calf muscles weaken from reduced activity, and the venous valves lose some of their elasticity. Together, they create the conditions for chronic leg discomfort that many seniors simply accept as inevitable. A study published in the Journal of Vascular Surgery found that targeted lower leg muscle activation in older adults produced measurable improvements in venous return velocity within a single session. Not weeks, not months. A single session of the right movement was enough to shift blood flow in a clinically significant way. That movement is what you are about to learn. Exercise number 5. Ankle circles. This is the warm-up movement. It is the one surgeons often begin with because it prepares the joint and the surrounding tissue before activating the deeper muscle pump. Done slowly and deliberately, it also begins to stimulate blood flow through the small vessels of the foot and ankle, the area where pooling most often starts. Sit tall in a sturdy chair with both feet flat on the floor. Lift one foot just slightly off the ground, just enough to move freely. Now rotate the foot slowly in a full circle, 5 times in one direction, then 5 times in the other. Then switch feet. The movement should be smooth and unhurried. You are not stretching aggressively. You are lubricating the joint and sending the first signals to the muscles and vessels in the lower leg that circulation is about to be supported. In daily life, the ankle joint is often the most neglected joint in the body. Many older adults go hours without moving it meaningfully, especially during long periods of sitting or watching television. This stagnation allows fluid to settle around the ankle, contributing directly to that puffiness that appears by late afternoon. A common mistake is making the circles too small. The goal is a full, comfortable rotation that takes the joint through its complete natural range. Small, tight circles do not activate the surrounding muscle tissue effectively. This movement takes less than 60 seconds per foot and sets the stage for the more powerful contractions that follow. Exercise number 4. Toe raises. While most people have heard of heel raises, toe raises are less commonly known, and they activate a different but equally important part of the lower leg circulation system. Specifically, they engage the tibialis anterior, the muscle running along the shin, which plays a significant role in moving blood through the front of the lower leg and supporting the return flow from the foot. Sit with both feet flat on the floor. Keeping your heels down, slowly lift the front of both feet, your toes and the balls of your feet, as high as comfortably possible. Pause briefly at the top. Then lower them back down with control. The contraction you feel along the front of your shin is precisely the muscle action that helps compress veins and push blood upward. Many circulation exercises focus exclusively on the calf and neglect this front portion entirely, leaving half the venous pump untrained. Research from the American College of Phlebology has noted that combining anterior and posterior lower leg activation, front and back, produces significantly better venous return than either in isolation. This is why surgeons who prescribe circulation exercises tend to pair toe raises with heel raises rather than choosing one over the other. A common mistake is letting the heels rise off the floor during the movement. Keep your heels firmly planted throughout. The heel stays down. Only the front of the foot lifts. Perform 10 slow repetitions on each side, breathing naturally throughout. Exercise number 3. Heel raises. This is the movement most people have seen before, but very few perform it correctly for circulation purposes. The speed matters. The control matters. And the pause at the top matters more than most people realize. Sit tall with both feet flat on the floor, hip width apart. Slowly raise both heels as high as you comfortably can, keeping the balls of your feet and toes firmly on the ground. At the top of the movement, hold for 2 full seconds. Then lower your heels back down slowly, taking at least 3 seconds on the way down. That slow lowering is where much of the circulatory benefit happens. As the calf muscle lengthens under mild tension, it continues to compress the deep veins of the lower leg, maintaining the pumping action rather than releasing it abruptly. In clinical settings, this is sometimes called the calf muscle pump exercise, and it is the movement most frequently prescribed after vascular procedures, long-haul flights, and bed rest. The reason is straightforward. The gastrocnemius and soleus muscles, the 2 main calf muscles, surround the largest veins in the lower leg. When they contract and release in a controlled rhythm, they act as a secondary heart for the legs. A study published in Phlebology in 2019 found that 10 repetitions of slow controlled heel raises in a seated position produced a 40% increase in venous blood velocity in the popliteal vein, one of the main veins returning blood from the lower leg, in adults over 65. A common mistake is rushing. Fast bouncing heel raises provide almost none of the circulatory benefit. Slow, deliberate, paused repetitions are what create the pumping effect. If this is the only exercise you take from this video, slow it down. Exercise number 2. Ankle pumps. This is the exercise that surgeons begin prescribing within hours of a vascular procedure. Before a patient stands. Before they walk. Before almost anything else, they are asked to do ankle pumps. That alone tells you something important about how effective this movement is at restarting venous circulation. Sit with both feet flat on the floor. From a neutral position, slowly flex both feet upward, pulling your toes toward your shins as far as comfortably possible. You will feel a stretch through the calf and a strong contraction in the front of the lower leg. Hold for 1 second. Then point your feet downward, pressing through the balls of your feet, contracting the calf fully. Hold for 1 second. Then return to neutral. That single back and forth motion, flex up, point down, is one complete ankle pump. Each repetition creates a powerful squeeze and release action on the deep veins of the lower leg, pushing a bolus of blood upward toward the heart. The reason this movement is so effective is that it engages both sides of the lower leg simultaneously, the anterior tibialis on the flex and the gastrocnemius and soleus on the point. No other single exercise activates both muscle groups in the same motion. A review published in the Journal of Orthopedic Surgery and Research confirmed that ankle pump exercises performed in a seated position significantly reduced venous stasis, the medical term for blood pooling, in older adults after as few as 10 consecutive repetitions. Perform 15 to 20 slow, deliberate repetitions. Breathe normally. If you feel any cramping, rest briefly and resume with a smaller range of motion. A common mistake is performing this movement too quickly, turning it into a nervous fidget rather than a controlled pump. Slow, full-range repetitions are what generate the pressure changes that move blood. Speed defeats the purpose entirely. Exercise number 1. Seated marching. This is the exercise that many vascular clinicians consider the most complete 5-minute circulation reset available to older adults, not because it is the most intense, but because it combines everything the venous system needs in one continuous, natural movement. Sit tall in a sturdy chair, feet flat on the floor, hands resting lightly on your thighs. Now slowly lift one knee, raising your foot a few inches off the floor. Lower it back down. Then lift the other knee. Alternate in a slow, deliberate marching rhythm, not rushing, not bouncing, but moving with calm intention. What is happening as you do this is remarkable. Each time a leg rises, the hip flexors and quadriceps contract, compressing the femoral vein, the large vein running through the thigh. Each time the foot returns to the floor, the calf contacts the ground and the calf pump reactivates. The two-sided, alternating rhythm creates a wave of muscular contractions moving continuously upward through the leg, mimicking the venous pumping effect of walking, without any balance challenge or joint strain. This is why seated marching is often the first exercise recommended to older adults who have been largely sedentary, recovering from illness, or unable to stand for extended periods. It delivers the circulatory benefit of low-intensity walking from the safety of a chair. Guidance from the National Institutes of Health highlights that rhythmic alternating lower limb contractions in a seated position improve venous return more effectively than static exercises, because the continuous alternating pattern maintains blood velocity rather than allowing it to drop between repetitions. Perform 30 seconds of steady marching, then rest for 15 seconds, then repeat for a second set. Over time, as comfort increases, you can extend each set to 60 seconds. A common mistake is letting the upper body rock from side to side. Keep your torso still and your movement focused entirely in the legs. The quieter your upper body, the more efficiently the lower body does its work. For older adults, this exercise supports circulation, maintains joint mobility, builds functional leg strength, and can be performed daily, even multiple times a day, without fatigue or recovery time. If you were to do only one movement every morning to support your leg circulation, this is the one most vascular specialists would choose for you. Over the last few minutes, you have seen how 5 minutes, done correctly, in the right sequence, can create a meaningful shift in how your legs feel for the rest of the day. Ankle circles wake up the joint and prepare the tissue. Toe raises activate the front of the lower leg that most exercises ignore. Heel raises engage the calf pump with the slow control that makes it effective. Ankle pumps create the most direct venous pressure change of any seated movement. And seated marching brings everything together in a continuous, natural rhythm that your body already knows. Each movement builds on the one before it. Each one adds to the cumulative effect. And together, performed in sequence, they take less than 5 minutes. When these movements become part of a daily routine, done each morning before standing, or during a long period of sitting, many older adults notice their legs feel lighter, less tight, and more reliable within 1 to 2 weeks. Not because something dramatic has changed, but because the system that was quietly failing has been quietly reminded how to work. Circulation does not improve through intensity. It improves through consistency and precision. Small, deliberate movements performed daily are worth far more than occasional effort. The long-term benefit goes beyond comfort. Supporting venous return reduces the risk of clot formation, protects your balance, eases joint stiffness, and preserves the independence that allows you to live fully in your own home, on your own terms. Aging does not mean accepting decline. It means choosing, each day, to give your body the clear signal it needs to keep doing its job. Now I would love to hear from you. Which of these 5 exercises felt most effective for your legs? Did you notice anything different right away? Leave a comment with your age and where you are watching from. If this video helped you, please like it, share it with someone who needs it, and subscribe for more guidance created specifically for older adults.